Welcome back. Building a hut and a hamlet. If there's any health discussion you should be listening to this morning, it's on News Hub, and we're going to talk about what is troubling us as a nation. All everything we talked about, the deficit happening with the country's healthcare sector, cleaner to clinician, exiting the country has had to deal with the numbers, and numbers are massive. Last time we checked around, about close to between 9,000-10,000 I had left the country in 2 years, medical doctors alone. We haven't talked of nurses and the other healthcare professionals that continue to leave the country in droves. The CBN put out a report some time back saying the foreign exchange being taken out of the country, close to ₦1 trillion was being spent on healthcare services overseas, which is far higher than the country's healthcare budget, by the way. Today we're going to talk about how we can deal with this brain drain. And it's always a pleasure to talk with people who are dealing with the solutions already. We've analyzed already the problems. And I think it's already time for us to deal with the solutions. In the studio this morning we have Dr. Fejiro Chinyonwoko. It's a pleasure to have you join us this morning.
Thank you.
It's with the Nigeria Solidarity Support Fund. General Manager, I understand, right?
Yes.
Brilliant to have you here, and thank you very much. We've remarked about how healthy she looked just before we came
Not just
here.
healthy, she looks beautiful. Thank you for having me.
Yes, we'd love to get medical care if you were ill from Dr.
Sincerely speaking, even when you're not ill, you need some advice.
And then we go to Abuja, where we have a number of resource people help deal with this discussion. Professor Innocent Ujo, the former president of Nigeria Medical Association. Thank you very much, sir, for joining us.
Thank you very much, and good morning.
Excellent. And then we have Dr. Ngozi Azodo, who's from the Director Department of Health Planning, Research and Statistics with the Federal Ministry of Health. She's representing the Minister of Health in the conversation this morning. Thank you very much for joining us.
Thank you very much. Good morning, viewers.
Excellent. So we'll come to the Abuja people first and foremost, and then let's begin with Dr. Fejiro here. We've got something we're working on, and you're working on also too, and I'm sure that people who have watched for several years and looked at those numbers of doctors and healthcare professionals leaving the country have been greatly disturbed because it's affecting the quality of healthcare services we face. How serious is this problem?
Okay, so I think I will let Professor Oja address this question, because I think that it's area, but I would say that in terms of the data speaks for itself. It's a serious problem. I know that yearly data shows that about 2,000 doctors leave the country every year. We also know that even the registered doctors in Nigeria, about 1 in 2, that's about 50% of the doctors are not practicing. So they're either in other fields, or they're out of clinical practice for one reason or the other. That's to show that the investment on training healthcare workers, we're getting 50% return on investment. And for nurses, in 2021, the data shows that we have over 7,000 nurses that left. And COVID also worsened this, because the first world countries increased their demand for healthcare workers to strengthen their health system to respond to COVID, and the pull factors were, I would say, were greater than the push factors to remain in the countries. So it is very, very serious problem, and we all know that. We're hoping that together we can make a difference in this problem and come up with solutions that can reverse these issues.
All right, thank you so much. So let's speak with Professor Innocent Uja, the President, Nigeria Medical Association, NMA. At this point in time, there's a reason we're talking with both of you first before we go to what the Federal Ministry of Health, would say. How would you describe the level of brain drain in the medical sector in the country at this point in time, and perhaps a personal experience within 2 minutes?
Well, thank you very much. First of all, let me thank Dr. Amenze for her doggedness. Did everything for me to appear on this program, even when I was dodging it. Not for fear of not participating, but for time that I couldn't allocate to myself. Secondly, I'm no longer the president of NMA. I'm the immediate past president of NMA. Having said that, the question that you raised, the issue that we're discussing, is very germane to health development and national development. It is a sad commentary to say that Nigeria is losing a huge number of experienced, trained doctors and other health workers to the developed countries where they don't even need as much. We have tried as the Nigerian Medical Association, when I was president, on the 4th of April this year, we had the first national lecture series of the Nigerian Medical Association, and it was based on issues of brain drain and medical tourism. There's no doubt that we have about 80,000 doctors trained in Nigeria. 50% of them, just like have been just stated, 50% of them are out of the country. They're out of the country for reasons that are very, very germane. We could talk about this. One is the push factor, the second is the pull factor. Let's look at the pull factor. The pull factor is that environments where they are going to clearly better than that of Nigeria. In basic necessities of life, primary needs of life, water, light, schools. As you know, I mean, for months now, since February, university system has collapsed. And apart from that, the epileptic power supply and the issue of dilapidation in the health sector. The hospitals have dilapidated and antiquated facilities for which it is difficult to cope with the current realities of the moment. Thirdly, the training, building capacity of health workers is non-existent. Thirdly, or fourthly, the work environment is very hostile. And just recently, you can see the issue of interprofessional rivalry that is in this country. Only last week, a doctor was locked up by a nurse for no good reasons. Again, that shows the frustration Nigerian health workers are going through. I believe that that nurse probably acted because she was frustrated at her workplace for many other good reasons. Now, we find that if you go to Europe and America, you are sure that you get your salary. Your emolument will be very commensurate with what you are, and therefore you are attracted to that place. The equipment are modern. You have a work environment that is conducive. Now let's even come to the push factor. Push factor. The environment in this country, as you know, even with the Boko Haram and the other insurgencies and kidnapping, obviously, we still have some of our doctors that have been kidnapped and have not been released, even when they have paid the ransom that they requested for. So the hostility, the environment is very, very, very hostile, and nobody would want to be in an environment that is very hostile, just like we are experiencing in Nigeria at the moment. The children are not going to school. I would not want my children not to go to school. But a state like Abia and Imo, they are owing salaries of over 20 months. How will anybody put in his best or her best when he's not being paid the meager salary that we're talking about? Recall that the issue of hazard allowance, which was 5,000 naira a month since the 90s. We negotiated, it took us 8 months to finally negotiate the hazard allowance, which now went to about maybe between 35 to 40,000 naira a month. We have not even seen, we have not heard about it. We are told that that has been agreed. So you find that so many things are wrong, so many things are not right. And it appears that nobody bothers about this. The Nigerian doctors have raised their voice to a high heaven. Unfortunately, they've not got anybody to respond to all these needs. I mean, and very soon we're only sitting on a keg of gunpowder. Very soon it will happen that the doctors and other health workers will be completely absent from the hospitals. Building structures, and okay, they are good, but they are not enough. And we believe that if you have built structures like building the hospital, putting up hospital buildings, there must be commensurate staff with commensurate capacity to manage our patients. Our patients are not getting the best, to say the least. We hope and pray that something will be done very quickly. And we thought that the Health Reform Committee set up by the President would have been up and doing, but unfortunately, we've not seen anything about our enemy president supposed to be a member of that committee. But up to today, apart from the fact that it was inaugurated in January, 27th of January, nothing has been heard about it anymore. So we are not really,
right.
as I see, there is not much commitment to the health of Nigerians.
All right, Professor Uja, excellent and great opening, which is great. We can bring in Dr. Azodo in here. Interesting, you have you manage the research statistics also too and planning. And when Professor Uja talks of a keg of gunpowder, I'm sure when you look at those numbers from a statistics point of view, if you had to do what was a multilinear regression analysis, you're probably looking at all the factors that are directly responsible. And for you, it makes your work a lot harder because they're all directly related to the problems we're facing in the healthcare sector. What would you say when you look at those numbers of healthcare professionals who are leaving the country, and how does this affect planning for the country's healthcare, nationally or even at the state levels?
Thank you very much, and let me appreciate those who have spoken before me. Professor Uja, good morning, sir. And my dear Sergio, thank you for also putting all the energy you put into this program. It's a major concern for anybody in the health sector, from the president down to the least person in the health sector. So we can't, we're in a crisis situation when it comes to human resources, and we recognize that. Before now, before the COVID, and I don't want to really go through the pull and the push factors that have already been spoken about by Professor Uja and Feji Roberts. Those cannot be underscored. If before now we have had crises of health sector workers moving away from the country, I have classmates, and I graduated over 30 years ago. I have classmates who left for similar reasons, but it's not as bad as it is now. What has happened since the COVID is that there has been an escalation of the crisis situation. The developed countries have had their health systems challenged, much more than they anticipated, and so the migration of health workers, the conditionalities precedent to migration has also been reduced. So there is people are moving out in droves. Of course, the same COVID and the economic situations around it have also affected the ability of government to support the health sector as much as it would, or the economy as a whole, to support individuals in Nigeria to perform their functions. The health sector workers are more opportune to leave, and so people will continue to leave. And so it's a major crisis situation. And so what is the government doing? We're looking at the numbers. If you look at the number of graduates that have entered the health sector in the last 4 years, it's been an average of 2,500 doctors per annum, except in 2020 when we had less than 1,005, about 1,300 doctors. We also know that the WHO recommended numbers is 1 doctor to 600 persons in the population. But what we have in Nigeria today is about 1 doctor to 2,700 persons, and that is getting worse. The WHO recommended number for nurses and midwives is 1 nurse to 3 to 5 persons in the population. Today we have 1 nurse to 300 persons, an estimated number. So it's a crisis situation any which way we look at it, and the government is not resting on its oars. So we're looking at a number of options to ensure that the pull and the push, the push factors are the ones that the government can address within the powers of the government to address. And so the government is looking at the push factors. What are the push factors? He had already spoken about remuneration of healthcare workers, the conditions of the infrastructure in the facilities, the general economic situation, the insecurity, the crisis, human resource crisis and the rivalry within the health sector, and of course the entire societal approach. I mean, we now find a situation where healthcare workers are under increasingly attack, not just from bandits and kidnappers and all of that, but even from family members who feel aggrieved, or people who feel, or patients who feel aggrieved. So increasingly the healthcare workers are endangered, and government is not reversing on its oars. And so we've looked at all the options. Through the years, there have been several reforms which the government has embarked upon. During the Obasanjo regime, we had the health sector reform program, which was a holistic look at what the health sector is like and what can be done to intervene in the health sector. One of the things that was achieved during that was strengthening or invigoration of the National Health Insurance Scheme to what it is now. That's what that did, was not just to provide insurance for Nigeria, but also to provide a source of funding that would be available to the health sector, to health sector facilities and practitioners, or to the health system, to improve itself. We also had the national the national health policy, which again addressed some of the issues we are looking at the human resources, all the pillars of the health system. Of course, there have been several efforts at improving salaries and emoluments of healthcare workers. There was also in the past the expansion and strengthening of health facilities. We had what we call the VABET project, which looked at strengthening 6 health centers, health facilities, tertiary health facilities around the country, and several of those efforts. Down the road, we also had the enactment of the National Health Act, which was one of the key elements and changes that happened in the health sector. What that did for the health sector was to create first and foremost, it defined the health system and tried to empower people to do what they needed to do, to create the boundaries, to create that will help us. In addition, it also created the Basic Healthcare Provision Fund. What the Basic Healthcare Provision Fund it did is to create for Nigerian health sector, for the very first time, a source of predictable and sustainable financing for health. Right now, it is 1%, at least 1% of the Consolidated Revenue Fund, which translates to several billions of additional funding to the health sector, targeted at primary health care, insurance, and also looking at emergency medical services.
All right.
Those are opportunities to strengthen the health system and to ensure that lack of funding and the issues around infrastructure for health is addressed. Thank you.
Dr. Azodo, I'm going to ask you this question. I'll be very glad if you can just give an answer within a minute so that we can pass around questions among you, our distinguished resource persons today. All of what you've said seem to be in the public domain, and you also mentioned yourself that in your time when you were very active, there were people, your colleagues, who also had to leave the country due to the fact that they were not pleased with some things that were happening. In this present dispensation, some would say that it's not about when you have so much. What are you able to do with the little that comes to you? Would you say that your ministry has been able to deliver on what comes to it in ensuring that the health sector in the country runs successfully?
The ministry has a lot to do with that, and is working hard on that. One of the things we are looking at now, we will have to address every problem as is. While people had left in my time, the problems have become different and the old ones have exacerbated, and that's why I went into the issues of funding for the health sector, predictable financial sustainability for the health sector. In addition, now we have had all these efforts which are incremental in nature. So what the government is doing now is looking at a holistic reform. There are several things in the health sector that cannot be addressed by anybody within the health sector, looking at the health sector alone. And I want to give an example, something that looks as ordinary as replacing a doctor who has left in a tertiary institution in Nigeria. Even the Minister of Health cannot replace that person by a fiat. So the process of replacing a healthcare worker in a federal institution is also a long process. So what the health sector reform, it is in response to all of these challenges that the government is now embarking on a holistic health sector reform program. which is chaired by the Vice President. And the Vice President chairing that process is significant because we needed somebody who had adequate power and adequate access to whatever institution that needed to change for us to be able to make the necessary difference in the health sector. Now at the ministry level, what are we doing? We are looking at, we've looked at all these issues. We are constantly negotiating for better care for health workers. We are constantly also looking at how we can improve the infrastructure within our facilities. We're also looking at how we can now make migration a win-win situation. Because of the international laws, and of course I'm a doctor, I do not want anybody to stop me should I choose to leave. But even the law does not allow anybody to stop anybody from leaving. So we are now looking at how can we work with other stakeholders to make this a win-win situation for us, so that we are negotiating with other countries, especially the countries that have the most they receive our healthcare workers most, to see how we can use the opportunity of their migration to strengthen our local institutions to produce more health workers. We're also looking at strengthening the existing institutions. There are so many regulations that stop us from being
Dr. Azodo,
from being able to expand the number of intakes maybe schools of nursing or medical schools. So we are now working with all the relevant institutions to see how we can increase, the capacity of our institutions to train more people.
Exactly, and I'm sure those to the wheel. We're going to get back to you, Dr. Azodo, to get some more thoughts on what you're doing at the Ministry of Health. Dr. Fejiri, I'm sure that she talks about partners, stakeholders, and you're also part of what is going on too, and in trying to resolve many of the issues the government on its own cannot, deal with. And what are the ways, what are the things you will say, for example, if you have a drop list, the top #1 objective and goal that you as a partner is looking at?
Okay, thank you very much. So Nigerian Solidarity Support Fund is an indigenous donor organization, and we're a resource mobilization organization. What we do is that we mobilize resources for 3 priority areas, and the first is we support vulnerable Nigerians. Second is that we support health system strengthening, and the third is that we're reskilling and retooling the Nigerian youth for the post-COVID era. And what we have done so far with the funds is that we identify very high impact health intervention, and we support those interventions. Like we're discussing today, the health system is broad. It's a system made up of different moving parts, and each part is very relevant. So while we know that we can't only build infrastructure, while we know we can't just equip the hospitals and support stock with essential medicine, while we know that health financing and funding, as important as it is, it's relevant, but we know that without the health workers in place, the health indices will not improve. Nigeria has one of the worst health indices in the country, if we're being in the world, if we're being very truthful. And if we look at the maternal and child indices alone, 1 woman dies of childbirth every 10 minutes in Nigeria, and 1 child under 5 dies every minute in Nigeria. That's really, really poor statistics. And we know that there's a relationship between healthcare workers, service delivery from healthcare workers, and maternal and child death. And I dare say, any other healthcare outcome is very important that the service providers actually give quality service. So Professor Oja talked about the quantity and also the quality, so the capacity of the healthcare workers, that they are really skilled in the area of service delivery. So NSSF is two-pronged approach for us as NSSF. First is that we advocate for these policies that would improve the health and development of Nigerians and the nation in general. And we do that by adding our voice, by having such roundtable discussions where we gather stakeholders together and we discuss these issues, and we actually identify solutions, next steps, quick wins that we can begin to institute, and very innovative ideas that we can bring on the table, not using what hasn't worked. What would work now? What are other third world countries doing? How are they improving their health system with the little funds that we have, like you kept hitting on, we have little funds. What can we do with those little funds? Secondly is that through our partner organizations, we fund implementing organizations that have very high health intervention. We fund them. In the spirit of additionality, we make sure that what they're doing is in line with the strategy of the government, and so that we are synergistic. So we're actually adding our funds to what the government has and their plans and their strategy through our implementing partners. And that's how we do it. So for example, last year we partnered with the National Primary Healthcare Development Agency to vaccinate 1 million Nigerians against COVID-19, and we met and surpassed that target. So we identify high impact strategy by the government, and we support them through funding with our
all right, thank you so much, Dr. Fejiro. Professor Innocent Uja, for immediate past president of Nigerian Medical Association, let me come to you at this point in time. The medical sector had gone on strike severally due to maybe pacts with the federal government that had failed continuously, and it had taken the intervention of some very notable Nigerians or bodies to get your people back to work. Now we have the representative of the Ministry of State for Health there, and I wonder if she's watching, listening, and the resource person as you are this morning. What are your greatest concerns today as to how the medical sector is run? Lead to brain drain, and even those that are staying behind and have not left the country are considering going abroad if they can. They want to undo and bolt at this point in time. So what are the words to her this morning, the questions that have been really, bothering you over the years, months, weeks? Let them out.
Well, we have not hidden our position with regard to improvement of healthcare for Nigerians. I can say clearly, as the president of NME for 2 years, I've been in NME for over 40 years. I can say clearly that nothing has changed. I have not seen any evidence that we are seriously tackling these issues. The reality is that, in fact, sometimes in November last year, I was going to Glasgow for this climate change conference. And one of the immigration officers saw me. I said, am I going? Am I not coming back? I said, no, that I'm coming back. I've decided to stay back out of patriotism. He says that on a daily basis, they see a lot of us going out of the country. And it is not a lie. Previously, it was only consultants that were going. But now, a resident, I mean, a medical student who finishes his or her house job is on her way out. Nobody wants to stay in this country. The situation is very bad, and I mean, what we are seeing is it's more percentage of the realities on ground. Every component of healthcare delivery system in this country is not working. Is that light? Is it water? Is it the infrastructure in the hospitals, the human capacity? I mean, for instance, the issue of saying you are training more doctors so that they replace the other. There is no way you can train a doctor today and replace my experience and knowledge. I qualified in 1978. I don't see how somebody who is trained today I will get the experience and knowledge that I have. So any one consultant that leaves or very senior doctor that leaves, there's no way anybody can replace that. It's a very sorry situation. What we do, let's create an enabling environment. Let the government of Nigeria be more serious in tackling these issues. The Minister of Health to come up with roundtable meetings to discuss this, because there's unusual quiet from the Federal Minister of Health. Because we need to be talking to ourselves. We need to evaluate what we are doing. What is the research component? What are we doing? What data do we have? We should be using the knowledge. Nigerians are very, very intelligent people and very committed when they are given the opportunity. But as I'm talking to you, we are not seeing those at all. If anything, we have been despondent. We don't know. Like I said, Abia for 20-something months, 23 months, the doctors have not been paid. Health workers have not been paid. for goodness sake, how would we expect any commitment from this group of people? It's also some months in Imo, Anambra. So what is the problem? And these are states that are benefiting from oil. Unlike those in the north that don't even have oil at all. They pay their salaries regularly. So is it the fact that they don't have money or the unwillingness to pay those who are working? So it is a hydra-headed monster. And like I said, we need to do something. There must be strategic intervention. The Federal Minister of Health cannot keep quiet for too long anymore, because nothing is coming out from the Federal Minister of Health. They should bring people to the roundtable meeting. Let's discuss this. Even the Basic Health Care Provision Fund we are talking about has been irregularly disbursed. And we are talking about the emergency component. This is about 5% or so. Is not coming. What is the private sector is supposed to be benefiting from emergency interventions, but we are not seeing that. So what we are saying is that we must have a roundtable meeting. It's not enough for me to be talking on the TV and another person talking on the TV. Let all health workers, or the representative health workers, sit and discuss the issue of health. The health committee that was formed, that was inaugurated in January, has not met today.
Right. All right.
So of what value is that health committee? We need to intervene. Things are bad, and I mean.
Thank you very much, Professor Uja. Thank you very much. And Dr. Azodo should respond to that in our closing remarks, together with what the Federal Ministry of Health does together with the state ministries of health. How do they coordinate to connect the dots so that we can have the same picture? Because it appears sometimes that you have some states going south and others going northwards.
Well, I didn't have that question. There was some background noise. Can I hear you?
About several meetings, several people talking, but no meetings happening to connect private sector and the healthcare workers together with the healthcare practitioners. And then I asked also too about the state ministries of health and the Federal Ministry of Health, and it appears that sometimes they're not working in synergy.
Well, thank you very much. Let me start from the synergistic relationship between the state and Federal Ministry of Health. We run a federation, and so we have, as expected, we have a lot of collaboration with the states. But the Federal Ministry of Health does not actually have the powers to, mandate or force the states to do things. And that's where really, issues like the Basic Healthcare Provision Fund comes in. Basic Health Provision Fund is basically a federal fund, but it is now being used to encourage the states to also invest in their own health system. Having said that, we have the National Council on Health, which is a meeting, created by law between the Federal Ministry of Health leadership and the state ministries of health leadership and the FCT. We meet mandatorily at least once a year, but several times a year as becomes necessary. Like during the COVID, we had so many emergency National Councils of Health meetings. There are also several meetings where we meet and we have resolutions that are actually implemented and monitored to be implemented. So when you come to issues of payment of salaries of health workers, those kinds of issues are addressed and states are encouraged to take on their responsibility. The Ministry of Health, however, is not in a position to mandate or compel the states, to pay certain workers' salary or in what form. So these are some of the challenges of the federation that we run. However, we have meetings with the Nigerian Governors Forum where the minister has gone severally to address them and address issues that affect the health sector across. So there are those consultations going on constantly. There's also, of course, the consultation with the private sector. And there is no way we can achieve any significant progress in the health sector without involving the private sector. The private sector members are so key. I mean, in some of our states, some of the states across the country, private sector practitioners provide over 60% of the health services in the state. So it's only, of course, a matter of course that we continue to engage them. I know that the minister had recently met with the Guild of Medical Directors. They have met with several groups of private healthcare practitioners. There is, of course, the need for us to have a holistic meeting, review of the national health system, especially now that we're in the post-COVID, we're in the COVID era. A lot has happened in the last 2 years. Many things have changed. Things have become different. Everybody who can live is living. I'm sure that even people who are not healthcare workers are also living because of the economy. But of course, the challenge is more in the health sector for obvious reasons. So that consultation is going on, and we are going to have that meeting as part of the health sector reform program. The Vice President is chairing the health sector reform program, and there's supposed to be a meeting.
Okay, I think that's the answer that Professor Jah was looking for. So the meeting is going to hold, and of course we hold Dr. Azodo responsible for that, because you said there's going to be a meeting.
Right, today we have at 3 p.m. we have a meeting of the Secretariat with the Vice President to now look at the framework and all of that. So conversations are ongoing.
All right.
And we have
all right, Doctor. I would do hope that after this meeting, you have to harmonize the meetings. There's one thing for the Federal Minister to be meeting with the Vice President and challenging courses to really ensure that all the questions raised get answers, but also the stakeholders are demanding for a meeting. So we do hope that you put in a word when you report back to the Minister of State and the Minister that the stakeholders really seek a moment, a sit down with you, so that you can iron out all of these issues that push our people, our doctors, our medical personnel out of the country so that they can stay. Thank you very much for that. Let's come to the studios, Dr. Fejiro, and talk about, we have to round off at this point in time. Some people say it's just all about the money, that even when the federal government starts to implement all the agreements that have been signed in the past, that many medical personnel will still want to get out of the country. How true is this, one? And two, at what point do you think the government would achieve the set goals that, for instance, Dr. Azodo had mentioned this morning, such that will make the medical personnel who really know that we need them more here than any other part in the world to stay home and take care of our business here?
Thank you very much for that question. So in line with remuneration being a key factor for retaining healthcare workers, I would say that remuneration is important, but in recent times, a lot of human resource people are beginning to speak more about work environment vis-a-vis remuneration, and I think that so applies to healthcare workers. I believe that a lot more people live beyond just remuneration. There is that commitment to the nation we don't seem to have because of every challenge that we are facing. So I'll say that people will stay when they have a reason to stay beyond just money, because how much more can we pay? We know the economy that we are in. We know the budget of the country. We know that we don't have the fiscal capacity to pay as much as the other countries would pay. So really, if we're saying just remuneration, then we are almost saying that it's dead on arrival.
When you say work environment, can you expatiate?
So on work environment, what I mean is that people they need to have a reason to stay. They need to have a why. They need to have something that keeps them. They need to feel like their work is important. What they are doing makes an impact. They need to feel valued. They need to see that I am not just an insignificant piece. I am a very significant piece in the puzzle. Without me, this system is going to collapse. They need to have that value. They need to be valued. They need to be appreciated. They need the basic amenities of life. We all learned in social studies, basic amenities of life, without which we won't even all be here. If we don't have a roof over our head, we don't have food, if we don't have clothing. So shelter, food, clothing, they need those. Then they begin to talk about what is the reason why I'm a Nigerian, and why. That's why we learned history in school, because it was supposed to engender commitment to your country, patriotism. We need to increase patriotism again. I'm not saying that people that left are less patriotic, but I feel that, when we are committed to a place, we tend to stay irrespective of what pull factors, are there. So I believe that if as a nation we begin to speak, hear these health workers, have that meeting where they are heard, again, where your pain is heard and felt. So they say a problem half shared is half solved. Are we even sharing our problem?
We have to go now, but would you leave the country if the package is so fantastic? Would you leave? What's your price?
That's really $1 million question.
Yeah.
My prize is, again, am I replaceable here?
Okay.
Am I replaceable?
Oh, that's profound.
Yeah.
All right.
I think I am so.
Oh, thank you for staying. Mwah, mwah.
Thank you very much. Thank you very much, Dr. Fejiro Chinyowoko, the General Manager, Nigeria Solidarity Support Fund, for the work you're doing. And thank you very much also to Professor Innocent Uja, former President of Nigeria Medical Association. It's been great having you talk with us also, too. Also, thank you very much, Dr. Ngozi Azodo, Director, Department of Health Planning, Research and Statistics, Federal Ministry of Health, who represents the Ministry of State for Health. Thank you very much, and we will touch bases with you because of the planning, research, work, and statistics that you do is very, very important to the work we also do on Newshub. Thank you very much.
Thank you.
Thank you for having
Thank you very much. Thank you very much, madam. Thank you.